military personnel and football players or sports people, they are used to receiving a lot of drugs to control pain. You're in a battle, you don't need to be feeling the pain, even if you're grievously wounded. So their chemistry is a little bit different than regular people, meaning they require a higher dose of pain medication in order to relieve their pain. And something that happens a lot is nurses confuse this with drug-seeking behavior. So then you have the veteran suffering in the bed, and all the nurses are saying that they just want drugs to get high.
So they have a higher tolerance, they require more?
Yes, because they receive more throughout their lifetime. If you are in the military and you get your leg blown off, if you want to be carried away, they got to shoot you up with morphine so you don't feel it enough so they can actually do their job. Welcome to the Nurse Multiverse podcast. My name is Gene. Today, we're going to be talking about ejection fraction and basic EKG interpretation. The first thing that we're going to look at is ejection fraction and how it's calculated. Ejection fraction is the indicator of how efficient your ventricle is at emptying itself. So how much blood is pumped out of the heart to the general circulation. The normal range is 50 to 70%. Less than 40% indicates congestive heart failure. So congestive heart failure is basically when there's too much blood in that left ventricle and it cannot empty itself fully. Ejection fraction is calculated with the following formula. Stroke volume divided by left ventricular end diastolic volume multiplied by 100. Stroke volume refers to the volume of blood pumped out of the left ventricle by the end of the diastole. And left ventricular end diastolic volume is the volume of blood just prior to the heartbeat and at the end of the heartbeat. Ejection fraction is usually measured by echocardiogram, which is ultrasound technology. And what ultrasound technology does is something very interesting. The probe head is covered by a layer of crystals called piezoelectric crystals. And the properties of these crystals are that when you shoot a certain wavelength of sound at them, they change shape. And by doing this changing of shape, you can get a graphical representation on a monitor of the internal structures of the body. So you can use it to look at everything inside of the body with minimal invasiveness. All right. So you have two types of echocardiogram, and the echocardiogram is what's going to tell you how efficient the left ventricle or right ventricle are. There are two types. There's the transesophageal or TEE, and that's usually done at the end of a coronary artery bypass graft or CABG. And what that's doing is sending ultrasound waves from the inside of your body out. And then you have the transthoracic echocardiogram, which is from the outside of your body in. The transthoracic is less invasive than the TEE. So the TEE is usually get done when the patient is under anesthesia and stuff. You got any questions about ejection fraction stuff? No. Okay. Now we're going to cover basic EKG. And basically an EKG is the graphical representation of the electrical activity of your heart, which makes a beat. So we are going to be talking about the following definitions. Telemetry. Telemetry is the automatic measurement of either electrical data such as voltage or current or physical data such as temperature or pressure. There's two ways to spell EKG. You can spell ECG or EKG. There's no difference between them. They refer to the same procedure. However, one of the is in English and the other one is in German. I don't know why we use the German one. But anyway, if you see ECG or EKG, they're interchangeable. They're not different. In particular, what is an ECG is a line graph that shows changes in the electrical activity of the heart over time. And they are made by an instrument called an electrocardiograph. I am not sure what they call the instrument that measures lie detector test, but that's also a similar device that measures a different thing. But you know, the I think the lie detector test, what is measuring is both your heartbeat in relation to your heart rate. Okay, and the ECG, there's not really a relation. It's just showing you the whole activity of the heart, and then you count how many of them you have in a certain amount of time, and that's how you calculate heart rate. The process, the little waveforms on the EKG include the P wave, which is depolarization of atrial myocardium, the QRS complex, which shows depolarization of ventricular myocardium, and finally the T wave, which is talking about repolarization of ventricular myocardium. All right. We are going to cover depolarization and repolarization later, but you can just Google it and figure it out. It's a term that is kind of a little bit complicated. It's not simple. Um, but yeah, so within the structures, we have different intervals, and these different intervals matter when you are diagnosing a specific type of disorder or if you're seeing that if it's normal. So, for example, the PR interval has to last a certain amount of seconds. If it lasts more than that or less than, then it could indicate a problem. Does that make sense? Then you have the QRS, which does the same thing. If you have a wide QRS versus a narrow QRS, keep in mind that what I drew here is just to show you the not to show time. This is not showing time in seconds like an EKG strip does. All right. And I'm going to show you how a 12 lead looks. A 12 lead is basically a way of looking at all sides of your heart. So it's measuring the electrical activity of the heart in all its sections. And that's usually what we do if you have chest pain, because that's how we can measure if it's actually a heart attack or not. Remember, we were talking about STEMIs and non STEMIs. So that means a non STEMI is a non ST elevation myocardial infarction versus a STEMI elevation in myocardial infarction. And you can see it here. You see the ST segment there? So that ST segment, if it's elevated, that indicates a STEMI. If you have symptoms of a heart attack and you have that, you go to a cath lab. We got to do something before the heart stops beating. If there's no change in that, then it's called an STEMI, and that's a non ST elevation myocardial infarction. And then finally, you have the T wave, which is the repolarization of ventricular myocardium. Now, I'm going to show you another picture real quick, and this is how we read a 12 lead. This, the doctor has to read this. The cardiologists have to read this, and they have to diagnose it. All right. This is a doctor thing. So you see right here in the bottom, we have the EKG that I gave you guys, just smaller. And when you do a 12 lead, you have lead one, lead two, lead four, lead AVR, AVL, AVF, B1, B2, B3, B4, B5, B6. They are placed in specific parts of your body. You can look it up a picture and you can see it's pretty simple. One on the leg, one on the other leg, one at each arm, and then you do like a little you put it, check it out, bro. You put one lead here, one here, and then right around your heart.
Okay, what do you mean by here, here, and here?
Oh, okay. So I'm saying where you put the 12 leads. So you grab 12 leads with our little sticky things.
No, for the people listening,
Oh.
what do you mean here, here?
Yes,
Here?
right leg, right arm, right chest, left chest, and then the last one go along the ribs. And that's 12. So when you have different waveforms, you have change in waveforms in the different leads, that indicates a different problem. And I'm not going to cover what specific problem indicates, but lead one is lateral, lead two, inferior, lead three, inferior. This is related to places in the heart. AVL is lateral. ABF is inferior. V1 is septal. V2 is septal as well. V3 is anterior. V4 is anterior. V5 is lateral. And V6 is lateral. And that's in relation to the heart, the lateral side of the heart, the inferior side of the heart. The septal is like the middle part of the heart. And depending on what's going on, all of these leads, if you see, some of them are upright, depending on the position. Some of them, the QRS is reversed. The T wave is reversed. Some other ones show less, I guess, a smaller waveform. This one is the perfect one. Anyway, so they have a different waveform per each of the leads, and that way the doctor can diagnose where is the problem particularly. It's very old technology. It's very interesting, and that concludes kind of like what we're talking about. I was looking some stuff up the other day, and I was thinking about when we were talking about neuroplasticize, and I was gonna like bring this to you because I want you to listen to this book. I'm obsessed with this book. Anyway. The book is called Elastic by Leonard M. Lundinov, and what it talks about is about how your brain learns and how your brain works, and it refers to the elasticity of the brain, meaning how flexible is your learning tendencies, how can you learn, and how humans learn basically. And a lot of people think, for example, the artificial intelligence is going to be here. What is like Skynet is going to be here soon. And we are going to be dealing with like, robots trying to take over the earth. But when you read this book, you understand that we don't even understand how the brain works fully. And the brain is a powerful computer, more powerful than we can ever make one. If you want to simulate how the brain works, you have to get maybe 100 computers and link them,
Mm.
because your connections, you learn with connections in the brain.
Mm.
And that's why when you want to learn people's names, when you know if their name is, I don't know, my name is Gene.
Uh-huh.
A lot of my friends call me Gene Bean. Why? Because that's how they remember my name, by making that connection. There's Gene and Bean are not related, but the fact that they rhyme, people are.
Right. It sounds the same. Huh?
Yeah. Like whenever I want to remember somebody's name, I just tie it to something ridiculous. Like Estefania, I imagine an elephant on a ball. It makes
What?
no sense. Yeah. That's how I remember that name. You know?
Okay.
Like when you're talking about arteries, you think uh, away from the heart.
Mm-hmm.
That's the A for artery.
Mm.
Basically, the more elaborate is your mnemonic,
Mm-hmm.
like a mnemonic is a remembering device, and your brain has limitless potential for that. You can have, I you can't even count. The neural network is basically a bunch of little neurons together. They form a big complex. Then that complex gets together with other complexes, and they form an even bigger complex.
Mm.
And computing, at least modern computing, the way we use it, is a system of zeros and ones.
So, do you know
Mhm.
Andrew Uberman?
No.
I really like listening to his podcast.
What
He
is
he's a neuroscientist.
what is a neuroscientist?
Neuro.
Oh, a neuroscientist. Yes,
That's how you say it. Neuro.
neuro.
He's a neuroscientist.
Yeah.
And he's also a professor for neurobiology in Stanford University.
Nice. Usually,
He's
just
got an amazing.
just a tidbit. If a doctor, a very important doctor, is not a professor as well, they're not that good.
Yeah.
Yeah, the best doctors are also professors.
Well, yeah, he's a doctor and a professor.
Those are the best. The elite doctors are always tied to a university. If you want to work for a good hospital, look at what university they tied to. Like for example, Jackson
Mhm.
used to kind of suck, and then started collaborating with them, and it raised the quality.
I see.
It
Because
rose
it started.
because you have to have teaching hospitals. If people are not, healthcare is about teaching. That's one of the things that I like to do this podcast with, because if I have to teach, I have to sit down and look at a subject left, right, up, and down
I see.
in order to guide somebody.
I see.
It's kind of like the blind cannot lead the blind,
All right.
but somebody that sees can lead the blind in the appropriate pathway.
Right. Right.
you know, and I feel like we don't have enough of that. Like
Mm.
doctors don't explain things to patients.
Oh,
They are really kind of crappy at that. And if you don't have a nursing team behind you,
that's got to be complicated, though, right?
what?
Because explaining, I guess maybe that's because there's a like an art form in itself. Like I knew,
It's psychology. If you don't know psychology, you can't do pedagogy.
so I had this neighbor, right?
Yeah.
His name was Mr. Bunch.
What?
Mr. Bunch.
Bunch.
That was his name, Bunch.
You know,
But listen, so and you know, like he was like he was like 70, like almost 80 years old.
okay, Mr. Bunch.
Mr. Bunch, very like very classic American. Like he's like when he spoke, he sounded like a TV show from the 20s.
America.
No,
Oh, not
not
America.
that. No, no.
Like Depression era?
Yeah, but like you know,
Like 20s, 30s, 50s?
no,
What?
no, yeah, he sound like an old TV show. Like, hey, yeah, hey, buddy boy. Like, not America, you know. That's not it. But let's see, he's very cool. So he had worked. He was a scientist
Mhm.
he had worked for NASA, right?
Okay.
And he like, I think he was like either like a engineer, like rock, like for rocket science engineer. Like I don't know the you know, I'm a dummy. I don't know the terms, but I knew that he worked, and he could not explain anything to you at all. You know,
What do you mean? Like what?
like he like I used to get along with him, but he had a reputation for a bad temper. You know,
Okay.
and he could not explain a single like if he had to explain something to you,
Yeah.
he couldn't like he couldn't give you directions.
Mm.
He was very bad at communicating.
Mm-hmm.
He was good at like he was very good at what he knew.
Mm-hmm.
He just didn't know how to communicate it back.
Mm-hmm.
You know what I mean?
Mm-hmm.
Like if you needed directions to go somewhere, like you know, just go there. You know,
Mm-hmm.
that's where's where's the laundry?
Mm-hmm.
Well, you know, laundry, you know, it's 3 blocks away. How do you get there? You know, get the laundry. He had like it was very hard for him to. So like the reason I'm saying that is because, you know, maybe like maybe all doctors are not teachers, or maybe just because someone's a doctor doesn't mean they're going to be able to explain things.
This is the thing.
Properly. You see what I mean?
Yeah.
Does that make any sense?
This is what's important.
But is that making any sense?
Well, you are not a practitioner of health if you cannot get your patient on board with you. And it's a psychological thing. If you go to school for medicine or for nursing or anything that's related to patient care, and you don't know psychology, like at least a grasp of it, then you should not be practicing. Pay attention in psychology class. Pay attention to the hierarchy of needs. Pay attention to the grief cycle. If you lost your mom, I need to find out as a nurse, even if you are my patient and your mom is my patient and you are just a family member that's in the room with me and your mom just died. And I don't know, or I cannot tell that you're going to get angry and punch somebody. Why? Because in the grief cycle, you go through different stages. Stages are anger, denial, bargaining, acceptance, and depression. I didn't say them in order, but those are. And it's just like Freud, the Freudian scale, whatever, of growing up.
But what if somebody knows those things? It's just,
Mhm.
but it's just they can't teach. Like,
No. Well, so you must know those things. You might not be able to explain it, but you need to know where your patient is in cycle of grief in order to reach him.
And doctors don't know that.
A lot of people learn it and they don't use it.
Oh.
It's like having a turbocharger and you're driving and you're not using it. So then why?
Well, I think maybe also like a doctor's like another job. Like
Mhm.
it's an important job, but at the end of the day, it's another job. And maybe there are like people are just not good at their job.
Absolutely. The way that
You know what I mean?
Yeah. So it's like this. I equate it to
You can have somebody as a bad mechanic. You know, all mechanics.
that's what I was gonna bring up.
Good.
That's what I was gonna bring up. The body is like a car, and the cardiologist is just a mechanic. So people
Yes.
that go like, oh doctor, oh doctor. No, the doctor's not God. The doctor's just a mechanic,
Right.
a biomechanic or a bio plumber,
Right. Right.
you know? And just like plumbers and mechanics, some of them are really good and some of them shouldn't be doing nothing. All
I
right.
see. Yeah.
Um, yeah. So if you don't know psychology or you're weak in psychology, it's the same thing as if you're weak understanding how the heart works. If you don't understand it and know how the heart works, how can you teach your patient about heart attacks? How can you can't teach them about prevention?
And that's where it comes rough because maybe some of them just don't care about teaching. You know what I mean?
And then you get bad healthcare.
Right.
And that's why hospitals that are not tied to a teaching institution are of lesser quality than a hospital.
Do you think that's because doctors that come from teaching in these institutions care more, or what?
Of
What
course,
do you
if
think?
you're a professor, then that means that you went to school and you at least did a couple classes in, I think the word is pedagogy,
I think so. I don't.
pedagogy or whatever. You did a couple of classes on that, and hopefully you did psychology and you did Maslow hierarchy of needs and you did the grief cycle and you know,
Mhm.
hopefully you did those things and you paid attention and then you put it in practice in order to maximize your potential for the patient.
Okay.
And if you don't know how to do those things, then you're half as effective.
Okay.
A lot of doctors and nurses like to work for places that are not tied to an educational system because it's easier. You have to think less. The
Mm.
standard is lower, so you don't have to bring your best every time. But if you work in a teaching hospital, you are expected to teach at all times. Everybody. You teach the person that cleans. You teach your coworkers. You teach your patients' families. You teach your patients, and sometimes you gotta teach your doctors.
I see.
You know, as a nurse, if you're not assertive enough, sometimes the patient's gonna suffer.
I see.
We have to speak up for the patients. Something that drives me nuts, and I know we're talking all over the place, but you know we're done with the focus that we're going to do today. So, a lot of patients that have chronic pain, and especially military personnel,
What
they
you were just asking for, it's
yeah,
pedagogy.
pedagogy. Okay,
That sounds.
that's just the art of teaching.
No, I know. I know. I like. I'd heard that before. It just sounds like a Pokemon.
It does. A Pokemon that teaches.
Pedagogy. It's a
the,
pedagogy.
the teacher Pokemon. You should make
So,
that drawing.
so you were saying about like soldiers and about.
So, military personnel and football players or sports people, they are used to receiving a lot of drugs to control pain. You're in a battle, you don't need to be feeling the pain, even if you're grievously wounded. So their chemistry is a little bit different than regular people, meaning they require a higher dose of pain medication in order to relieve their pain. And something that happens a lot is nurses confuse this with drug seeking behavior. So then you have the veterans suffering in the bed, and all the nurses are saying that they just want drugs to get
So they
high.
just they have a higher tolerance. They require
Yes,
more.
because they receive more throughout their lifetime. If
I
you are
see.
in the military and you get your leg blown off, if you want to be carried away, they got to shoot you up with morphine so you don't feel it enough so they can actually do their job. Or if you're shooting somebody and they break your leg, you got to continue shooting.
Right.
If you're a football player and you especially NFL, they have 16 games. They start healthy and by game number 16, they are destroyed. And a lot of times a team loses because they're not healthy, not because they're not the best. But anyway, so this kind of people have a higher tolerance for drugs, and that doesn't mean they're junkies. But then typically when you get a one of these people in the hospital, the nurses all of a sudden turn into rehab nurses.
Mm-hmm.
The hospital is not a rehab place. That's why you have rehab clinics
I see.
to go and treat your addiction. You don't treat your addiction after a heart surgery.
I see.
No. You receive medication in order for you not to hurt. And then if we gotta get you off of it, there's ways to get you off of like fentanyl addiction is very prevalent. And it happens because when you're in the hospital and you can't move, we gotta give you loads and loads of fentanyl. And then you get out of the hospital and you're addicted to that. And there's ways to decrease the addiction. Last thing that I wanted to talk to you about is, have you ever heard the James Baldwin versus William Buckley debate?
No.
So it's funny because you were talking about Mr. Bunch and
Yes.
how he talked. And back in the, I'm gonna say 50s and 60s, a lot of journalists had like a different inflection in their voice. Like they sounded kind of like almost British, but not British. And this guy, William Buckley, is a Republican commentator. He is, he's super funny. I love watching him talk. I don't agree with his political views.
All right. So we're gonna be closing out now. All
Yeah.
right.
So check out that debate.
Check out which was the name of the debate.
Is James Baldwin versus William F. Buckley.
James Baldwin versus
Yeah, James Baldwin is a black writer. He's
Ver-
done
James Baldwin versus the other.
versus William F. Buckley.
Okay. And this is
This is the Nurse Multiverse podcast with
Right.
Gene.
please subscribe, and if you're on Spotify, like and follow the channel so you can get more of this great content coming your way.
And we are about to finish with the heart, so we will be thinking about where we're gonna go after that. And soon we are going to have our first guest who's gonna talk about ventricular assist devices, which is a
Nice.
fairly new technology. I'm excited to have him on.
So let's stay tuned for that. Thank you, everybody.
Thank you.